How to choose a treatment for your patient? This is a question which is equally asked by somebody who is just starting in Colourpuncture and somebody who is working in Colourpuncture for quite a while and they want to go to the next level with the same patient they're working on and getting some results, but not the results they feel they can get. Or when they feel that person is just ready, they're getting all the results they want, for example, on a physical level, but they want to take them further emotionally, psychologically, spiritually, and they want to go to the next level. They want to choose a perfect treatment. There are different ways to choose a treatment. And if you operate in a clinical setting, and if you see a patient who is presenting mainly with physical complaints, this is where you start. You start with your diagnostic. You do several ways of diagnostic, never stick to just one. And this is how you figure out where to start. Obviously, you go with your manual, you go with all the knowledge you have to date, you choose a treatment based on diagnostic. When you just learning Colourpuncture, you start with Colourpuncture. You don't have much experience working with people with Colourpuncture, working with people in general. And so you want to learn the rules first. You try different ways of diagnostic. You see which one is preferable for you, and always do more than one type of diagnostic. So, for example, if you do back segments, then you need to include fingertips. If you do diagnostic on the forehead, you include fingertips, or you include the feet diagnostic, you include the back diagnostic. If you run a clinic and patients coming to you primarily with physical conditions, then obviously you do all the diagnostics that you know, and then you ask them for all medical diagnoses they have, all the test results, and then on this basis, depending on your general knowledge, you choose your treatment. Second way to start is if you're already a therapist and you practice, for example, acupuncture. In acupuncture, there is a set of diagnostic approaches. Or you're a reflexologist, you have your diagnostic. Or you already know some diagnostics such as kinesiology, such as iridology. Then you can start with this. You can translate acupuncture into Colourpuncture. You can translate reflexology into Colourpuncture. You can translate massage into Colourpuncture. You can translate many things in Colourpuncture once you learn the principle. And this is something that you normally learn on a very first part, in an introduction to Colourpuncture. So you already have this knowledge to start. So if you just do introductory training and you're already therapist of some other discipline and you know the language of Colourpuncture, so to speak, you can start translating. Third way is to listen. Think about it. Patient comes, first you talk. When you talk, you listen to the person. And when you listen to the person, you already can pick up some clues if you're very attentive. Listen for the words, listen what they're trying to communicate. Look at the body language, listen to what they're saying. Very often they will tell you what they need. If somebody is coming and saying, I do not see my path forward, I don't see where I'm going in my life, then you do one of the thalamus treatment, thalamus line or some simple thalamus points, because this is something that in Colourpuncture we use when people are unclear on their path. If they come and say, I'm all over the place, but there are no clinical finding, I'm all emotional, there is a PMT, there is a PMS, and all this, then you give them some endocrine treatment, very often just simple balancing endocrine treatment, basic endocrine reaction test, anything along these lines. If somebody comes to you and saying, I find life so difficult, I'm having trouble relating even to this, you give them ellipse of material existence. If they come in and complain about the mother or nurturing or caring, deep experiences, family, home, childhood, you can give them mother ellipse or mother therapy. If they're talking about self-expression, their inability to find their true identity, problem with the father, problem with males, problem in generally with energy, then you give them father ellipse or father therapy. Very often people will tell you what they need. Number 4, choose a balancing treatment. Choose a balancing treatment when you're not sure what to choose. It could be either one of the coordination treatments, coordination 1, coordination 2, coordination 10, coordination 9, any of coordination treatment which you feel will be appropriate for this person. And then what happens, because coordination treatments, they are treatment for balancing, they are restoring some balance. In the process of restoring the balance, very often things which are out of balance will come to the surface. and they come to the surface, and then you can act upon it. Not necessarily within this treatment, maybe taking it to the next, or maybe giving them homework, but the problem will very often show itself. Or another situation can happen. They can get really relaxed with your balancing treatment. They don't feel anything. There are no insights. There are no physical problems, but they're just getting deeply relaxed and peaceful. And their symptoms subside. They're feeling great. And this is your balancing. So coordination treatments. If this is somebody who is more advanced in terms as patient, so they're coming to you not for the first time, balancing treatment is something that you will tend to give to people who are new, or people who didn't go that long way in terms of Colourpuncture, because they still need this general balancing, and this is the totally appropriate stage. But when somebody with you quite a while and you want to take them further, you can give them one of ESA treatments or one of the heart treatments, because those treatments, they're like a tip of the pyramid. And from the tip of the pyramid, you will see better what is the problem. So ESA treatment can show you the way. Heart treatment is the same way, can show you the way to the elements, either physical organ systems or emotional counterparts or anything along those lines. So you can really zoom into the elements, and you can plan your next treatment, or again, you can give them homework on the elements, coming from 5 elements of Chinese or 4 elements of Greek or whatever system you're using in Colourpuncture. And number 5, thinking back to our patient visit. The person comes, they sit down, you offer them some tea or some water, they start talking. So you've done your observation, you've done your body language observation, you listen to them very carefully, you notice the words they're using, especially verbs which they are using, you notice their body movement, and so they talk about emotions. Then you do your diagnostic. So the body might tell you something slightly different, or might reiterate what the person is saying. And then sometimes what happens, you just feel what to give them. It just somehow it comes to you. Either this is a sum total of your general perception of the situation. Here is this person, that what they said, that what the body is saying. This is how they're feeling, this is what I know. And then this is the summary which your unconscious or conscious mind makes for you in an instant. You know what to give. Sometimes it's very interesting what happens, especially with people who you know for a long time, your long-term clients. Somehow you're attuned. You are together in energy field when you connect. Sometimes what happens, you feel what to give them before they actually arrive. You think of some treatment, you think of this person who is coming, this would be really great treatment to give. Sometimes it happens to me. Not every time, but sometimes it happens. And when it does happen, I tend to trust, because it happened absolutely randomly and there is no active participation on my part. Sometimes I'm expecting a patient, and in the morning, a thought comes, I need to give them this. And then totally, seemingly irrelevant treatment comes. And I'm thinking, okay. But by nature, I'm very skeptical, and I'm asking a lot of questions. So as they come, and then I'm starting questioning my intuition, if you wish. So I'm doing diagnostic, I'm asking some questions, and it turns out, 9 out of 10, that my first perception was right. I do not know how it works. I think there is no metaphysics or mystic to it, or mystery to it. Maybe there is, maybe there isn't. I don't think it's relevant. I think when you are attuned to the person energy field for a very long time, when you're working with them, you share, you experience what they're experiencing in a way, and then your whole sum total of knowledge and expertise and skills suggests the next natural step.